Hi, this is Paul Tyler, and welcome to another episode of the Reimagine podcast. And Laura, welcome.
Yeah, we're back. It's great to be here. Still virtual, but it's a wonderful day. And today we have with us Adil Malik from Clearstep. So I'm pretty excited to get into the conversation and learn more about Adil, yourself, your company, what you're doing, and how you play into Hartford. So I guess without further ado, tell us a little bit about yourself.
Sure. Thanks for having me on, both of you. Really appreciate the time. So, my name's Adil. I'm one of four co-founders of Clearstep. And prior, we'll get into Clearstep. So prior to Clearstep, I was in healthcare consulting, and even before that, I was actually in medical research at Hopkins. And when I really think about the genesis of Clearstep and really how it got started and how we had the inspiration to start it, I really trace it back to the days of doing research. I think the spirit of innovation in the lab and trying to discover something new and using the scientific process to innovate planted the seeds, I think, for wanting to do something at greater scale and working in digital and working in the industry. So yeah, I've really my professional career started in the lab, and then I decided to pivot into more the industry side and commercial side of healthcare, working in healthcare consulting for a few years, and that really gave me the macro lens on the industry that ultimately led to Clearstep, and happy to shed light on any of that.
Yeah, well, let's talk about Clearstep. You gave, and we'll this is one where we'll pull a thread, so we'll telegraph the end. So we saw your demo day in Hartford, and I will tell you, I watched what you'd done on screen, and it was phenomenal.
Sure.
But can you tell people? Some people watch the video, some people will be on here, but what exactly does Clearstep do, and what's the problem you're tackling?
Yeah, absolutely. So at the highest level, Clearstep makes it really easy for healthcare consumers to know what care they need, to be able to find and access care. Um, Now, the problem that we're solving kind of is multifaceted. There's the consumer problem, which I think everyone is very familiar with. It's really hard to know exactly what you should do for healthcare when you have new presenting symptoms, or you have some symptoms that have been bothering you chronically over some period of time. It's really hard to know exactly what you should do. It's even more difficult to know how much that would cost and who's a network, and be able to digitally schedule it. So this is the friction in the experience of trying to find care is what we're solving on the consumer side. Kind of bringing all of the relevant information that someone needs to be able to know what care they need and where to get it and how much it'll cost, and that's what we're providing. However, we're not a direct-to-consumer company, right? So we aren't going and trying to market directly to consumers. We are selling and licensing and configuring our software for existing healthcare organizations, mostly payers and providers, but on the retail side as well. So the problem there that we're solving, let's kind of take the health system example, is that health systems are kind of archaic in the way that they operate and how they deliver information to patients. And we've kind of recognized the need for them to innovate, to create new digital channels for people to be able to find and access care. And the reason why this is so important is that health systems are under increased pressure and increased competition, right? So there's now minute clinics, doctor on demand, all sorts of virtual care, One Medical, Row, Hims and Hers. There's all of these direct-to-consumer, digital-friendly, consumer-first solutions out there that are trying to take care away from more traditional brick-and-mortar hospitals and health systems and clinics. And if health systems want to be able to retain this patient base, they really need to provide a much more digital friendly means for people to know what care they need, and promote virtual care when it's an appropriate option, promote price transparency, and make it easy to actually book care. So that's really, and there are additional facets, right? The health insurer problem is a little bit more unique. The retail clinics problem is similar to the health system one, but has some unique aspects to it too. But broadly, this is, the need for digital transformation is really acute in healthcare, particularly with these big, large, old healthcare organizations. And so, there's this consumer problem that I think we're all familiar with, and then there's this health system problem that's becoming, really top of mind for health systems as they look to harness the power of digital.
Okay, so when I walk into my healthcare clinic or the doctor's office, okay, Paul, here's your board, fill out the questionnaire. In a sense, is kind of what your problem is doing. You've kind of done that on steroids and done it remotely, so it actually gives me more information, but also shares with the care provider. Is that
so? So it isn't so much intake, right? Like the situation you're describing is you already made the decision to go in person, right? You're already there. And that's fine, right? There are definitely companies working to make that intake process much more streamlined and efficient. We're trying to get you before you make that decision, because there's so many people that, the health system thing, if Paul, you're showing up and you're actually filling out the paperwork, they're like, great, we got Paul. Like that's awesome. He's coming in for care. He's an active patient. But there's hundreds of thousands or millions more that have symptoms that need care or need preventative care that just won't go. They won't show up. And it's because of all the friction involved in the process. And they're the ones more likely to go use the more digital-friendly, user-friendly tools out there to find and access care. So that's really the problem, right? Like health systems need, on their website, in mobile apps, promoting on Google ads, like here, when you're Googling your symptoms, Hartford Healthcare posting an ad that says, come find care with us, and we'll make it really easy for you, with the Clearstep interface. That's really kind of the angle that we're going after.
So, all right, I'm trying to think, and again, Laura, you're going to get us back. We'll unwind the whole story. So, we watched you at the digital healthcare pitch night demo day. Yeah. When was that? My mind goes.
That was like early February, February 10th, something around there. Yeah.
Okay, so what was the biggest healthcare concern then? And now, I've told it, everybody, it's like, oh my God, post-COVID, wow, has it like accelerated what people are doing? But tell us, what was what was the medical problem before, and then how did this whole pandemic shift or focus your efforts?
Yeah, it's a really interesting question, right? So broadly, for us, very specifically for us as a care navigation solution, things, the problem we were solving didn't really change. It just became much more emphasized, right? So before, we were pitching our solution as, hey, health system or health insurer, you really need a way to be able to, in a more user-friendly way, let your patients or your members know exactly what care they need and when they should get it and where they should go, without them having to pick up the phone, without them having to browse encyclopedias of information online. Just really easy 2-minute encounter, know exactly what they need to do. And when COVID hit, this became a really big problem for health. They really needed to make sure that, one, their call lines weren't being overwhelmed. So, with nervous patients calling. Two, that people who didn't need to be coming physically to the hospital were not coming. That people who did need to physically be coming to the hospital were coming. And that everyone else who had symptoms or had some kind of concern that did need medical attention were doing it virtually. And that's literally exactly what we had already been set up to do. And so we've been kind of pushing forward this narrative. Hey, you all need to do this. We have a solution that can do this. And then COVID happened. It's like, oh, okay. Now everyone realizes they need to do this. And it's not like this is some innovative idea that we'll work on in the background over the next, year or 2 years. This is like, can you get this live now, like next week? And that's what happened, right? So it was really, obviously we created a standalone COVID screening solution as well, outside of just our core kind of virtual triage experience. but the core concept was exactly the same. And so it really just it did focus in a sense, but it just underscored the same problem that we were trying to solve from the beginning, and made it much more acute for our buyers.
Yeah, we've heard that in a few conversations we've had, especially since COVID took such a dominant role in our lives. So my curiosity is, it sounds like you were on track, you were doing these things. They saw now the heightened importance of the immediacy of kind of following through with your product.
Right.
Now seeing where that shook out, what do you think, what would you add next? So if you were already there back in February and then this
Yeah.
hit, what comes next?
Yeah, so there's a whole long product roadmap of stuff we're working on, and the reality is right now our deployments are really just focused on that initial navigation piece, right? What are relevant fulfillment options for you? Is this an ER thing? Is this a take care of yourself at home? Is this something in between, urgent care, virtual care, right? So that's just the starting point. So even in I kind of opened up describing how people need transparency beyond just where to go. It's how much will it cost, when can I go, who are the in-network providers, right? So even finishing out that storyline is kind of what's immediately next, right? So right now it's just kind of this directional care guidance that we're providing for the most part to patients that use Clearstep. But really the next phases of it is give us your insurance information. We'll actually contact your insurer, which we've already built these mechanisms, but we haven't deployed it with anyone yet. We'll actually check where you stand on your insurance and your deductible and your out-of-pocket max and what your co-pays will be, and we'll give you that insight while you're making the decision of whether you go to urgent care or virtual care, so that you have some insight into the actual cost and let you know what's in network and out of network, and then integrating it to scheduling systems as well, so that you can actually book care. Like all of those kind of three things of provider matching, price transparency, and scheduling are big kind of chunks or big pieces of product to actually roll in. It sounds so simple and obvious because it should be, right? It's like we should have that level of transparency and ease when we're looking for care, but that's not there. But besides that, I'll also touch on, we are working on, Baycare Health in Florida, is a really great partner of ours, and we're working with them on some pretty cool projects to actually track symptoms over time. So we already did this with COVID, where when COVID patients were discharged from the hospital, they're actually enrolled in a Clearstep symptom tracking program, where they're actually texted a link to a unique kind of Clearstep domain on a predetermined cadence, and then they're reporting whether the symptoms are getting better or worse, and all this information is actually getting immediately sent over to the care management teams and populating their dashboards, and they're able to immediately see if symptoms are escalating or not, and pick up the phone and call the person and intervene as necessary. And so we're expanding that use case of care coordination or symptom tracking to additional use cases as well outside of COVID. So that's a pretty cool and interesting product area that we're exploring too.
Yeah, well, it's like fascinating. I saw what you're doing and thought this is tremendous. And I think the way you're simple, people have got to go out and take a look at your interface. I think it's incredibly, you made some very complicated issues and questions very simple to look at. So, kudos to how you're designing and thinking through this.
Thanks.
Now, when we talk to a lot of startups, they throw their arms up. Paul, it takes this long to get a contract or POC done with insurance company. If there's any sector that's probably harder than an insurance company, it's working your way, I believe, through healthcare providers for contracts. Now, pre-COVID, I'm sure it was a ton of work to get through procurement departments or whatever the vetting is on the healthcare side.
Yeah.
How has that changed? You probably had, I'm presuming you were competing for attention pre-COVID. Now you're trying to engage with a very stressed out symptom. How has building, how have the challenges in terms of getting or maintaining momentum changed?
Yeah, so maintaining momentum, like it's something we think about all the time. And to address the contracting thing, right? Yeah, you're right. Things started moving very quickly for like during the actual months when COVID was like, when we were going through the thick of it, right? That's when, there's an article out there that we contracted the Baycare and went live in like 9 days from like first conversations, like going live, right? That's like completely unprecedented in healthcare. And we actually did something similar with Hartford, and we got a COVID screener up really, really quickly with Hartford Healthcare. Now, we've seen contracting cycles kind of not return to what they were before, but maybe middle ground in between, right? So people are able to take a bit more time to actually plan out what they want to do in terms of rolling out our core solution, right? It's still moving more quickly than it was in the past. But I think the key difference now and before is something we've already kind of touched on. It's the awareness and desire of our customer base, right? Like if health systems want something, if the customer really wants something, they can make it happen. It's just a matter of you being on that, top 3 or top 5 priority list for them, that they're actually going to think about you every week, to make sure meetings are getting scheduled and documents are getting shared and whatever needs to happen to actually push a contract through or get a product off the ground. So now, even outside of just the COVID screening solutions, customers who want care navigation, it's a priority for them. So we are kind of moving through stages of contracting cycles quicker than we were before with other customers. But it's still thought like it's healthcare, right? It's still very thought. You still have to get big buy-in. There are many stakeholders across the organization that need to get aligned. In terms of how we're maintaining momentum, right? It's we're trying to capture. We're just trying to capture on the interest, right? So opportunities like this to share what we're working on, getting kind of the word out there that Clearstep has this really powerful, really robust navigation platform that can literally from any symptom take someone to the exact right care for them. That this exists, that we're doing this with really big names in the industry, and that you should have it too, even if you're a small health system or a single hospital system or a small health insurer. Like this is kind of the future. So we're really just trying to position ourselves from just from an external kind of imaging or marketing perspective to capture on the interest that's there. Yeah, it's a complicated, we've grown so fast that kind of thinking really proactively about making sure that is sustained is very top of mind. There are many ways that we're trying to do that.
So how can the consumer help? I know that it's, your focused payer provider, but as a consumer, this sounds fantastic to me. Like,
Yeah.
Why would I not want this for myself or for my family?
Right.
So what can I do as a consumer? Do I walk into my doctor's office and say, hey, have you heard of this? By the way, like, how can we help spread the word?
Yeah. That's a good question. Yeah, I mean those kind of small things of asking your healthcare provider if they've heard of it. We aren't really working with single practices, right? We're more working with enterprise, or we're delivering enterprise solutions and generally working with people at the corporate level. But if there are people in your network that work at health systems on the corporate level or insurers or whatever it might be, that's probably the best way. But if this is something that people are interested in checking out as well, you can access the basic form of our symptom checker online from our website at clearstep.health. And you can submit feedback and let us know. That's another way that's always helpful. We always look and read. We actually get live notifications every time someone submits feedback on all of our computers to see what people are actually saying about the product. So yeah, feel free to go check it out and let us know what you think and submit feedback to us. We definitely take all of that seriously.
Yeah. So Dia, also tell us, like, what motivated you to sort of dive deep into this? Is this technology? Is it experience with medical care? What made you start down this path?
Yeah, I mean, like I kind of mentioned at the beginning, I've always been really interested in healthcare and specifically innovating in healthcare. It's what really drew me to research in the beginning. For me, there are differing reasons, right? Bilal, our COO, who's in the middle of his MD PhD at Northwestern, taking a break and doing Clearstep. his reason is very clinical and patient focused, right? He really wants to be able to deliver, and that definitely motivates me as well. But I think what really has been, you know, the motivating factor for me was just seeing the power of the promise that technology like this had, specifically when I was in consulting, right? Working with big enterprises, always talking about digital transformation, and realizing that people were always talking about AI diagnostics and what can be done to improve kind of the diagnostic pathway of patients. And I just felt through my experiences there that people weren't taking the right approach to it. And that there were better ways to actually capture and harness the potential of technology. But what was really clear to me through those consulting experiences was that the problem on the business side was really huge. That if you know, health systems didn't innovate in this direction, that they were kind of under there are going to be some existential problems in the future because of those other, you know, brands like CVS Health and One Medical and these other brands. They really needed to innovate in this direction. Otherwise they'll go bankrupt. They'll lose their patient bases over time. So that the actual business problem that was being faced was really motivating to me to say, you know, we can actually use digital technology and build something different than what currently exists to actually tackle this problem. So I think I was really passionate about the business side and the industry and the macro level problems, and, you know, Bilal was really passionate about the patient level, and that was a great combination to have, because it forced us to think in a way as to, you know, what will actually serve both of these populations in the best way possible.
Well, that's great. So I guess looking ahead a little bit, and not that anyone has the crystal ball, the proverbial,
Yeah.
We know you had a short bit of time to enjoy Hartford. You know,
Yeah.
I guess, you know, are you planning on coming back? And if so, you know, what can the Hartford ecosystem do to help continue to support you and kind of help you down this journey that you're on?
Yeah, no, so definitely enjoyed the time in Hartford. It was a great opportunity to kind of work so closely with Hartford Healthcare for those 3 months and kind of get introduced to others in the ecosystem. And, you know, right now we're working with two big names in Hartford, and it's been really meaningful for the business. And so we're really thankful for the opportunities that Hartford has provided. And, you know, we'll when COVID settles down, we'll definitely be making trips over to Hartford at the very minimum to visit our current partners. But I think, you know, in terms of continuing to be helpful, even if you all did nothing more than was already done, I think it's been extremely helpful. But, you know, for us, we're trying to get the product out there more and more, right? We're trying to get with healthcare organizations that are thinking like, oh, you know, this is an interesting area to explore, but not sure how to wade through all of the options. You know, we want to be able to get in front of those types of people to you know, just share what we're working on with Clearstep and the amazing results that we're seeing with other customers, right? We, you know, to date, hundreds of thousands of people have gone through our COVID screener and been triaged to the appropriate level of care through there. As of recently, you know, millions of people across the country have access to Clearstep via some of our partners. And so we're trying to build on this momentum. And you know, Hartford has so many strong and well-known healthcare organizations and you know, insurance companies in the ecosystem, in the community there. And so there's undoubtedly more opportunity to work with other kind of Hartford players, and we're really excited about that potential.
Hey, that's great. And listen, Adil, thanks so much for your time today. What's the best way for people to try your product? I guess if you go to your website, and that would be clearstep.health, correct?
Exactly. And you can contact us through there as well.
Okay. And if people want to contact you directly, what's the best way?
Yeah, you can reach out to me directly. My email is my first name at clearstep.health. So Adil at clearstep.health.
Okay, great. Laura, I don't know, what other questions do you think we have for Adil today?
I would say if you had to choose one word to describe what you're doing, what is it?
Good question. Really, technically triage, right? It's triage. We're making it really easy to get routed to the right care, and that is by definition triage.
It's awesome.
Yeah, well, big deal, huge problem today, right? Huge
Yeah,
problem
exactly.
by hospitals. I rode by one today. There were yesterday with a tent for, yeah, it's anything,
Yeah.
any help you can bring here is terrific. So, listen, Dill, thanks for your time. Laura, thank you, and tune in again next week for another episode of the Reimagine podcast.